Hello, my name is Henry Lancashire. I am the admissions tutor for the Biomedical Engineering programmes here at UCL.
Hello, my name is Rebecca Yearworth, and in this presentation my colleague and I are going to be telling you about the Biomedical Engineering programmes here at UCL. I am the Programme Director for the Biomedical Engineering programmes. The Biomedical Engineering programmes were started in 2014 by the Department of Medical Physics and Biomedical Engineering here at UCL. We recognised that there was a real unmet need for there to be a new generation of engineers working at the interface of maths, physics and the human body, i.e. biomedical engineering. Biomedical engineering is an interdisciplinary subject and it's a rapidly developing field.
While the degree programme is relatively recent, we are a much older department. We are one of the oldest biomedical engineering and medical physics departments in the UK with a wealth of experience. Our department boasts faculty members who are leaders in their respective fields. Our researchers are working on groundbreaking research and innovation, providing students with the opportunity to learn from the best scientists and engineers and stay on the cutting edge of biomedical technology. This means you get to work in state-of-the-art facilities with the latest technology. We are a department who really get to know our students over the course of your degree. We also have excellent connections across other engineering departments and also nearby hospitals. We work closely with clinical teams and patients, so we are engineering solutions to the most pressing clinical problems and embed this into our research and teaching.
Key staff are our head of department, who coordinates our teaching and research. Then there's us, the Biomedical Engineering Programme Director and Admissions Tutor, who deals specifically with the Biomedical Engineering programme. Our teaching and learning team keep the course administration running smoothly. Our student advisor provides personalised assistance to all our incoming students. And all of these excellent staff, the ones not on the slide, we couldn't fit them all on, who will teach and support you throughout your time at UCL.
UCL is one of the top universities globally. UCL is consistently ranked among the best in the world. We have a diverse student population from across the world with a nearly 50-50 gender balance and over 600 undergraduate and postgraduate students in the department community you will join.
You might be asking, what does an engineer do? Engineers solve technical problems. They design and develop new products, building on their underlying knowledge of mathematics and of the physical world. What about a biomedical engineer? As biomedical engineers, we also build on our knowledge of the human body so that we can design and engineer products and technical solutions related to healthcare and well-being.
On this degree programme, you will learn not only how an engineering device works, in terms of hardware, software, components and embedded electronics, you will also learn how to apply or interface engineered devices with the human body. Biomedical engineers are truly interdisciplinary.
Our department falls into two broad categories. Medical imaging, using engineered devices to read out from the body for diagnosis and investigations, including MRI, ultrasound and advanced X-ray imaging. And then we have medical therapies and devices where we use our knowledge to impact the body, treat conditions and improve clinical practice, including work across neural implants, proton therapy, radiotherapy and cutting-edge surgical robots.
We now offer the UCL Engineering Foundation Year programme as a route into our Biomedical Engineering programme. The Foundation Year is for UK state school students, refugees, mature applicants and those who may not have gone through the traditional academic pathway. This might be for you if you have not studied maths or physics. You can find out more on our website.
We have two undergraduate biomedical engineering degrees, the BEng in biomedical engineering, which is 3 years long, and the MEng biomedical engineering, 4 years long, the master's variant of the programme. The programmes share the same first 3 years and you can easily switch between the two programmes up until the end of the third year.
Both degree programmes are accredited by the Institute of Engineering and Technology, the IET, a world-leading professional body for engineers. The accreditation is a globally recognised mark of quality for our teaching and will benefit you through improved employability following graduation and ensuring you have the skills and knowledge for an engineering career. The Biomedical Engineering Programme is part of the UCL Integrated Engineering Programme, the IEP, an innovative and award-winning teaching framework. The integrated programme celebrates multidisciplinary nature of engineering and embeds practical, hands-on engineering right from the beginning of your course. This brings the whole of the discipline of engineering together across subjects including electronics, computer science, and mechanics.
The entry requirements for the 2 degrees are the same, and they are assessed in aggregate. You do not have an increased chance of getting into the degree programme if you pick one rather than the other. So just apply for the programme that most interests you.
On the screen, you can see the current diet for the Biomedical Engineering Programme. In Year 1, we give you the foundation you need for biomedical engineering. This includes the professional skills and fundamental knowledge across maths, anatomy, the physics of the human body, electronics, and computing. In later years, we build on the foundations and deep dive into subjects including biomechanics, neural engineering, orthopedics, and medical devices. In your 3rd year, you take a 1-year research project. You're embedded in a research group in the department and work in new science alongside our academics. For example, undergraduate project students have investigated how the human skull influences the transmission of ultrasound into the brain for modulation of brain activity, how we can use artificial intelligence and virtual realities to better train surgeons to undertake keyhole surgery, and have analysed data from multi-centre clinical studies of electrical impedance tomography.
If you are completing a 4-year MEng degree, you will complete a group project where you make a prototype device to address a real healthcare need, as well as taking additional courses at master's level. During years 2 and 3, you take an integrated engineering programme minor. This is a set of 3 interconnected courses that lets you specialise in something you're interested in. This slide gives you some examples of the typical IEP minors which will be available during your 2nd and 3rd years.
A really exciting part of the Biomedical Engineering Programme are the scenario weeks. During your first 2 years, we have weeks set aside where you have no other courses, and on day 1 of the scenario, you are given a challenging biomedical engineering problem to solve. You work in a team over the week to solve the problem, and on Friday you present your solution. Here are 2 previous examples. The pulse rate detector app challenged the first-year teams to design a mobile app that used their mobile phone camera and flashlight to detect pulse rate. In a scenario like this, you bring together your knowledge of programming, sensors, engineering, and signals with your knowledge of how light interacts with the human body. And on the right, the wearable tech for marathon runners scenario challenges students to use low-cost programmable electronics coupled with sensors to build devices which will improve performance. Student solutions here include a hydration monitor, a temperature monitor, and a gait monitor. There has never been a more exciting time to be a biomedical engineer. The field is moving quickly through advances in computing and AI, with integrated electronics, rapid manufacturing, and computer-aided design enabling you to go from a concept in the morning to a prototype in the afternoon.
How to change the world? This is another exciting part of the programme. It's like a 2-week-long scenario, but it is shared with the other departments in the faculty. So you get to work with students from electrical engineering, mechanical engineering, management science, realising and seeing how these skills from the other departments can be pulled together to solve a challenging problem. A problem such as how to supply energy services in rural Africa, or how you can find solutions to congested traffic in urban centres. And we all have something to contribute.
A series of facilitated workshops across the 2 weeks help you engage not just with the engineering aspects, but also the social, political, and economic dimensions of the problem, which are really key for working as a professional engineer. At the end of the challenge period, you are asked to showcase and pitch your solutions to a panel of experts.
What does a typical week look like? They vary, but a typical week looks a bit like this. 12 to 16 hours of lectures, 3 to 6 hours of practical time, problem-solving learning classes, a 1 hour of personal tutor time, and self-directed learning. You need to carry out self-directed learning and coursework preparation outside of the classroom.
We take a lot of pride and care in the pastoral support we give our students. We have mixed year tutor groups where you learn from students across all years of the programme and from your tutor, one of our academic staff. Tutorial sessions cover topics including finding internships, preparing CVs, finding accommodation, navigating life in London, and all the soft skills you will need as you progress through your degree. You can also have individual meetings with your tutor to discuss issues which arise. When you first arrive at UCL, we also have first-term mentoring programme organised by students from senior years, which helps you hit the ground running and answers any questions you might have.
The department doesn't work in isolation. We have close links with UCL hospitals. We are affiliated with lots of the hospitals across London, which are directly connected into our teaching. For example, in biomedical engineering ultrasound, consultants from the hospital come and give guest lectures. So whilst we are teaching about the engineering of ultrasound devices, the clinicians are giving you the medical content, including how the devices are used, what diagnostic information is needed, and what constraints there are on using ultrasound.
We also offer a study abroad programme. In the third year of your MEng degree, you can do an exchange with one of our many partner universities, including in North America, Europe, and across the rest of the world. Studying in London provides a multitude of cultural and professional opportunities. London is a global hub for biomedical engineering firms and startups, offering a wide range of internships and job opportunities. But London is also a fantastic place for music and the arts and a fun place to live.
At UCL, we have an active and diverse student union with lots of clubs and societies across sports, gaming, language, subject interests, and hobbies.
Within our department, we are really social. We have lots of activities, including staff-student mixers, pizza nights, we have a boat cruise, so you really get a chance to interact with the staff and students and form lifelong friendships.
As you approach the end of your degree programme, and even before that, we have an active UCL Careers Service. They can help you by providing access to careers events, careers fairs, panel events with employers, etc. Workshops, helping you think about new career skills, and one-to-one guidance appointments. Help like CVs and interview technique. The Career Service offers workshops, one-to-one guidance, careers events and opportunities to improve your CV, practice interviews and standardised tests, and anything relating to starting your career following graduation. We also have a wide range of other student support services, including a team of expert wellbeing, disability and mental health support staff. In our wellbeing service, we provide a safe, confidential and non-judgmental space to discuss any issues and support your studies. This is open to all UCL students.
So what can you do when you graduate with a degree in biomedical engineering? What you will learn in biomedical engineering is to draw on skills and knowledge to solve brand new and unseen problems. This makes you very employable, and our graduates are highly sought after. They go on to work for major medtech companies, startups, the NHS, further study including PhDs and master degrees, and to careers where you can use your transferable skills, including finance and consultancy.
This concludes our introduction to the biomedical engineering programmes here at UCL. Thank you for watching, and I would love to welcome you to UCL in the future.